This is the paperless. The transition is happening. Now we are actually getting to the paperless mode. I don't know, we had Russian press people also. Putin left behind some of the press. Yeah, I did.
Now we are going to have a...
I think we'll start. Thank you. Very good afternoon to everyone, and thank you for joining in this press conference. As you're aware that we just concluded our cabinet meeting. We had 5 agendas were discussed and approved today in the cabinet. First agenda was regarding the bonded nurses from the period of 2008 to 2012 who were earlier appointed, and there are about 221 of them, and also there were the paramedic staff along with them, which again were bonded between the period of 2008 and 2012. And today in the cabinet we discussed in detail. As you remember, last time we had made the decision that all appointments made post 2007, which were not in the procedures and were ad hoc in nature, will be then advertised, and recruitment will take place for that. So in that process, the bonded nurses also were included in that particular list. But after detailed discussion with the health department, and also based on different conversations with the bonded nurses and going through all the documentation, we have decided as a cabinet today that the appointments were made during that period and procedures were followed, and hence the cabinet today decided that the bonded nurses and the bonded paramedics who were appointed between 2008 to 2012, we have decided to confirm those appointments that were made and recognize them, and so basically the recruitment for those posts will not be done, as we have already approved and as I said, recognized the appointments that were made during that particular period, purely for, as I said, the bonded nurses and the bonded paramedics. Number 2, the rules were framed for the Meghalaya Pharmacist Service Rules. We did not have service rules for the Meghalaya Pharmacist, so those service rules were approved today by the cabinet. Also, there was the adoption of the Meghalaya Mental Healthcare Rules. Again, these are very important. So we have different institutions that are dealing with healthcare, rehabilitation, and other mental health care activities. And as a state, we did not have rules to operate or to govern, or no policies were in place. So today we have passed those rules, and we're calling it the Meghalaya Mental Healthcare Rules. Then we had a decision also today for the regularization of excess area on government lease lands. As you're aware, there are a large number of lands in and around Shillong which have been leased out many years back, and periodic renewals takes place every 30 years or so. And in that process, normally the documentations and the files have to come to the government, and therefore it's a very long and tedious process, and it requires a lot of officials to be involved, and hence we have decided to simplify the procedure. So we have simplified the procedure And most of the delegation and the power has been given to the Deputy Commissioner. So the Deputy Commissioner can take the decisions and do the renewals at a much faster pace without it having to come to the government. So certain decisions were made for to make the entire process easier and smoother. Last decision that was made in the cabinet today was the proposal for the amendment of the Meghalaya Judicial Service Rules 2006 and the Meghalaya Higher Judicial Service Rules 2015. So these have been done as per the recommendations that have come from the judiciary, and these are mostly to do with the conduct of examinations and what kind of exams, what kind of syllabus, and how the direct recruitments will take place, the percentage of that, and also, as I said, to look at the different procedures of the recruitment. So those were the decisions. Suggestions were given, for example, that knowledge of local language of Khasi or Garo will also be mandatory, and we have accepted that recommendation also. So therefore, all those kind of recommendations were made, and we have approved and accepted those recommendations. So these were the 5 agendas that were discussed in the cabinet today. Thank you so much.